I think it's important for patients with IBS-C as well as for providers who treat IBS-C is to know that there are different treatment options and that one of these treatment options may be effective for one patient and perhaps not for the other. So it's important to explore the efficacy or the effectiveness of each treatment, and then to find out which one is effective for a given patient. So and in the end, when you do find a treatment that works for them, they are extremely grateful. And when they come back and they say, you know, a year ago I couldn't do certain things, now I can. It's extremely gratifying. Some patients who are not fully responding to a particular prescription therapy are sometimes afraid to try a new option. They are grateful that they have had some response, and sometimes because they have had an improvement, they said, well, maybe the new treatment will be worse, maybe it will not be as good as what I'm taking now. So sometimes they are hesitant, and what I try to do is to tell them that they are not married to this treatment, that they, when they try the new treatment, they can still go to the previous treatment. And so I, sometimes have to hold their hand a little bit, tell them about the new treatment, educate them about it. Sometimes they need to think about it. They kind of research it on the internet on their own, and then they come back. And I always strive for to have the greatest improvement, of course. Sometimes they are 50% better. And when I speak to some of my colleagues, sometimes they think 50% is pretty good. In my book, it really is not good. I try to go higher. I try to go for at least 80 to 90% if I can. It may not always happen, but that's what I strive for.